Hello, good evening. Environmental regulators say the public can have complete confidence that contingency plans are in place to dispose of clinical waste from the NHS. It follows yesterday's news that the company which deals with the waste had ceased trading, with the loss of hundreds of jobs. Aileen Clark reports.
Yesterday at Healthcare Environmental HQ in Shotts, the news for the workforce was grim.
No wages, they're not getting any money tomorrow, we're getting absolutely nothing. No pay, we've been redundant, no jobs, nothing.
But inside this plant, another problem: clinical waste being stored by a company who say they have ceased trading. The managing director of HES refused our interview request, but told us our permits are within licensing limits by a considerable amount. However, NHS Scotland are storing waste throughout Scotland in unlicensed sites. Please ask SEPA for that information. SEPA say at the HES site at Shotts this week, they still found some waste was not being dealt with quickly enough. Meanwhile, contingency arrangements put in place by NHS Services Scotland to collect clinical waste from hospitals and other medical facilities have been in use since the 7th of December. SEPA denies Mr Pettigrew's claim that some of that recently collected waste is being stored in unlicensed sites.
We've been working with these NHSS and NHS boards to make sure the appropriate environmental permissions are in place. Our staff continue to monitor those sites on a regular basis, and the public can be reassured that the relevant controls are in place and SEPA are ensuring that they are being complied with.
And SEPA were keen to try to reassure the public that even now the main operator, HES, has completely stopped collecting waste. The contingency network of other sites will cope and cope safely. Aileen Clark, reporting Scotland.